We are learning series of lecture of elements. We learn about the hydrogens, then helium. Today we are going to learn something about lithium. We learn it how hydrogen form, then how it formed to the helium, and exactly how lithium form. When two atoms of helium burn each other, they form the lithium, which atomic number is 3 and we denote as Li. Exactly, lithium is mood stabilizer. Exactly, it is very good medicine for bipolar disorders, depressions. So, how it used in homeopathy? Exactly, if you see the formations of lithium, when two atoms of helium burn in each other, they form, they fuse inside. So it is difficult to separate when there is a burn, when two atom of helium burn, it is very difficult to differentiate. So that's why these patients in the proving what the rubrics come. Exactly, the first rubric which I notice is mutilating his body. Mutilating his body means when two helium atom burn, so that's why there is a rubric mutilating in his body. Then suicidal dispositions. Exactly, when two atom suicide and form the lithium. Exactly, they burn. It is one type of suicide. Then beeping alone when. There is a rubric beeping alone when, because it is difficult to differentiate. It is difficult to separate. So that's why they having beeping alone when. Then impulsive. Why impulsive? Because when you mutilate your body and your suicidal tendency, then but naturals, they are impulsive. Then mania alternate with depressions. There is a rubric mania alternate with depressions. And helpless feeling at night. When there is a darkness, there is a helpless feeling. There are different other rubrics where this single lithium medicine is present. What is that rubric? Loss of vision, light by sunlight. Loss of vision, light by sunlight. Exactly, if you see, these process start from the hydrogen. Then when proton burn or explodes, then helium form, and when the two atom of helium burn, the lithium form. So exactly, there is a always explosion is going on in the sun, and in that situations these all atoms forms, these all elements form. So that's why there is a loss of vision, light by some sunlights. So other rubric, that is helpless feeling of night, means when there is a darkness they feel helpless. The other rubrics, that is extremities grab something ambulate upper limb, means they have, when they grab something they feel ambulations. Exactly, in this rubric also, if you before burning, when you burn each other, you have to grab each other, and there is a something as it is no more, it is difficult to separate. The other rubric is inflammations of joint, small joints, then weakness, paralysis accompanied by stiffness. So in all these rubrics, what we have seen, it is difficult to separate. It is difficult to separate. So what the feeling come in the lithium patients, it is difficult to exit separately. I am totally dependent on someone. This is the exact issue of lithium, and we know that lithium is a mood stabilizers. It help to release chemical like dopamine and serotonin in our brain. It help us to control over emotions. Exactly. In this way, it help in bipolar disorder. We know that bipolar disorders are, they are so obstinate, they are so hurty, they are so means when they attach with something, exactly they want to do it like a doctor, like engineer, like a business persons. When they attach to something, they always give 100%, but in that situations they sometimes they start getting or losing their health. In such a situations, these medicines help like anything. So this is what about the lithium. Thank you.